Hi, my name's Catherine and I'm the Head of Cancer Information and Support Services with Cancer Council Victoria. This presentation is to update you on the Access project, which is supported by the Victorian Government. We want to thank you for agreeing to be a key contact for this project at your health service. Your support is so appreciated and it's vital to the success of this important initiative. While we had originally planned to be able to deliver these sessions with you in person, due to COVID, we know how stretched you and your teams are, so we hope this virtual update will be helpful for you. Today, we'll provide you with a brief overview of the Access project and how we plan to support you in delivering supportive care during COVID-19 and beyond, the Cancer Council 131120 service and our model of care, our statewide supportive care services audit and how this is being used to support the project, the education webinar we'll deliver to support you and your teams in building capacity and referring to 131120 as a complement to your existing supportive care services and referral pathways, your role in supporting this work as a key contact for your health service, and next steps. So, why the Access project? Throughout 2020, we saw a sharp increase in the volume and complexity of connections with our Cancer Council 131120 service, as demand for support services increased due to COVID-19. We also heard consistently from health professionals like you about the challenges you faced and the pressure placed on resources to provide adequate supportive care screening, referral and support to patients and families, and we know these impacts are ongoing. Given the likelihood of increased demand on health services due to COVID, we know demand for supportive care screening and services such as counselling and access to practical support will continue to intensify. We understand that it's likely to increase the strain on you and your teams, many of which are already under-resourced, and that this inevitably places people affected by cancer at greater risk of falling through the gaps. Working with you and your health services in the Grampians and Barwon Southwest regions as our pilot sites, the Access project aims to support you and your teams to respond to increased demand for supportive care screening, psycho-oncology and practical support referral during COVID, to understand your current screening practices and referral pathways to ensure local services and supports are utilised to their full capacity, to work with you to identify gaps in your supportive care services and referral pathways based on the specific needs of the people you support in your region, and to engage with you and your teams to embed new referral pathways to Cancer Council 131120 that can facilitate increased connection and engagement with additional supportive care services as a complement to current care. We will also be working with Deakin University to evaluate the project and its outcomes. A snapshot of the overall project and timelines is provided here. Phase 1 of the project commenced in March 2021 and will run until the end of June 2022. During our pilot phase, we will be working with participating health services to develop our approach to data collection and referral pathway implementation, and will work closely with you to monitor and evaluate what's working and what could be improved. We will also provide you with feedback and reporting on how referrals to Cancer Council are tracking as part of the project. We will take learnings from the pilot and begin to roll out to participating health services in the remaining regional ICs from January to June 2022. Phase 2 will begin mid-next year with the rollout to metropolitan ICs and health services, and we'll also begin focusing on scoping and developing initiatives that will aim to improve access to supportive care for those in underserved populations. The project aims to assist in alleviating the pressures placed on you, your health services and your staff by helping you to implement simple referral pathways to Cancer Council 131120. Our hope is that this pathway will allow you and your teams to provide easy access to additional support services for patients and families that fill any current gaps in care that you're currently facing. We will also work with you to ensure any current service referral pathways are maximised and create additional capacity via 131120 where we can if your local services are already stretched. As a result, we aim to also improve outcomes for the people you support by increasing access to effective supportive care screening that can identify and address unmet needs at any point in the person's cancer experience. Initially, we'll focus on improving support to those living in rural and regional areas, and later in the project, we'll begin to focus on initiatives that will better support underserved populations. We hope many of you will already be familiar with our Cancer Council 131120 service. Staffed by experienced cancer nurses, it acts as a gateway to credible informational, practical, and emotional support and assists people to navigate their cancer experience. Our nurses provide tailored supportive care screening, assessment, education, and referral. We have a database of over 470 support services statewide and will work with you throughout this project to ensure that people receive the benefit of locally available support, in addition to programs offered via Cancer Council Victoria, other cancer organisations, or community services. The Access project is our opportunity to continue to collaborate with you to build capacity and to integrate referral to Cancer Council 131120 to assist your teams in filling any service gaps and to ensure people receive support when it's most needed. Our calls are not time limited, and nurses can arrange follow-up calls and emails to provide further support or to assess if services we've referred to have been helpful. Anyone impacted by cancer can contact our team on 131120 or via our Ask a Nurse email service, and you as health professionals can now also refer people directly for tailored information and support based on any needs you identify using our new online cancer support referral form. We know that you and your teams will often be the ones who will identify unmet supportive care needs. We also know that providing easy and timely referrals can be challenging, and that people may require support that is either not locally available or that capacity of local services may be limited. To ease these time and resourcing pressures, we've created this online cancer support referral form to provide you with an easy way to refer to our 131120 nurses. With your patient or family member's consent, one of our nurses will proactively follow up with the person via phone or email to follow up on supportive care needs or services that you have identified that they might find useful. The Cancer Support Referral form is located on the Cancer Council Victoria website. Simply click on the Health Professionals tab, then select Cancer Support Referral to complete the form. Once you submit the form, the details will be emailed directly to Cancer Council's 131120 nurses who'll contact the person within 2 business days. Importantly, our nurses will also send you a summary email identifying the outcomes of the referral that you've made. We'll let you know of any services or follow-up calls that have been put in place, and if possible, you may also choose to record this information in the person's file at your health service as evidence of the support that was actioned as a result of you referring to us. To build stronger connections within the regions and to support the ongoing implementation of the Access project, we have also employed 3 new regionally based 131120 nurses. Taryn and our 2 Liz's are working on the 131120 service part-time and in oncology services within Stawell, Geelong and Ballarat. In collaboration with our ICS contacts, they will also be your key contact points on the ground and will be available to assist you and your teams in implementing and monitoring referral pathways. They will also provide ongoing support and education for your teams as they build their awareness and confidence in referring to Cancer Council and other supportive care services. Similarly, they will be upskilling our broader 131120 team to ensure their understanding of regional needs and available services are up to date. As a key part of the project, Cancer Council Victoria is conducting a supportive care services audit with participating health services in the regions to help us understand your current practice, service availability and gaps in care. The audit will allow us to capture information about health services supportive care screening practices and which settings this is usually conducted in, current supportive care services available in health services and local areas, any existing internal and external referral pathways used, and information about the current capacity, or lack thereof, of any local services. The audit will inform how we work with you to develop and implement referral pathways to Cancer Council 131120 based on your health services needs, a communication strategy and collateral development to support you and your teams in engaging with the project, and as well as Cancer Council services more broadly, and an update of Cancer Council Victoria's Cancer Services Guide resource. We're really mindful of your time, and as such, it will be your local ICS contacts who will support the majority of the supportive care services audit data collection. Where needed, the ICS will contact you directly for support in completing this information. However, we expect that this will be minimal. As the key contact for your health service, your primary role is to help us understand how we can make the Access project work best for you and your team. As mentioned, we'll be looking to you to provide advice regarding project activities and support information collection about your current supportive care screening practices, referral pathways and local services, to input to the development and implementation of referral pathways to Cancer Council 131120s that will address gaps in care, and to think about where this pathway might sit within your service, to provide guidance on activities and resources that we can deliver to support you and your teams to utilise this new referral pathway, to provide us with suggestions for who we can engage with to promote the project across your service and to support us to connect with these individuals or groups, and to facilitate evaluation to gather feedback on the pilot and to identify learnings. Following this briefing session, our next activity will be to deliver an education webinar for you and those in your team who are most likely to be using the Cancer Council referral pathway moving forward. The session will cover in more detail how the Access project will help fill supportive care gaps as a result of the pandemic, information about Cancer Council 131120, our support services and our role in providing supportive care screening and referral, how this service is designed to complement your existing services and referral pathways, how you and your team can refer people directly to 131120 for follow-up and support, and to discuss the ways in which we can provide you with feedback on the outcomes of the people that you refer. To facilitate maximum attendance by you and your team, we ask that you please let us know your preferred days and times to attend a 45-minute webinar using the Doodle poll link in the email that you received. A summary of next steps, actions and timelines is shown here. From here, we'll need you to nominate the preferred days and times for you and your teams to attend our education webinar using the Doodle poll link in the email you received. We know that workloads can be unpredictable, so as much and all as we would like as many of you to attend live as we can, the session will be recorded and shared with you all for those who can't attend on the day. A member of the Access project team will follow up with you soon to discuss any questions that you may have, and we'll be sending out the services audit for the ICS to begin completing. Once we have a date and time for the education webinar for your region, we'll share this with you and we'll ask you to send it on to those in your team who will be supporting the implementation of referral pathways to Cancer Council 131120. This session will be scheduled for late October or early November, and we look forward to having as many of you there as possible. To summarise our take-home messages, the Access project is here to support you and your teams. Our main aim is to reduce the pressures you're facing in providing supportive care as a result of the pandemic. Cancer Council can help you to fill supportive care gaps in your health services, to better support people affected by cancer, and to ensure they have access to any and all cancer support services available to them. From here, please start thinking about how you might be able to embed referral pathways to Cancer Council into your current practice. And remember, you can start referring to Cancer Council at any time from now via our online form or by calling us on 13 11 20. We welcome your feedback, so please feel free to call us at any time. Throughout the project, our regional 13 11 20 nurses, Cancer Council Victoria staff and our key contacts at the Integrated Cancer Services will be here to support you. While we aim to be in regular contact with you, you are also welcome to contact us directly at any time should you have any questions, concerns or ideas about the project that you'd like to discuss. We're more than happy to arrange a time for any follow-up discussion, so please don't hesitate to contact me at any stage, and we thank you again for your support of this important initiative.